If we look at the purpose of the work group, I think there's a number of industry needs, but at the highest level, we have to improve data exchange around the specialty continuum, whether that's the initial prescription, the information that the pharmacy needs or the hub might need to enroll the patient, all the way through to dispensing and reporting.
Is really the transparency and the visibility. So you have a new patient who's just diagnosed with a horrible diagnosis. They don't know what to do next. Unfortunately, they don't know where to get their medication. They don't know how their medication is going to be paid for. They don't know how to administer their medication. So this is really where we're focused, is how we can improve all of these things that were not visible to the patient and help with that transparency.
Specialty medications are very different than a regular medication that you can just get filled at the local pharmacy. So it starts all the way from identifying whether your prescription is covered under your medical benefit or your pharmacy benefit. There's questions around where you can actually get the prescription. There's questions around the cost of the prescription. So all the way from when the physician prescribes it to actually dispensing it or administering it, there's needs across the board. It's a very manual process today, a lot of phone calls, a lot of fax, which is why it can take up to 2 to 3 weeks for a patient to get on medication, and that's just wrong. We need to get that sped up, we need to get the patients on their therapy faster, and we need to be able to help them understand what the medication is, how they can pay for it, how they can get the medication, and so really the needs of the industry are broad and wide.
So patient impact, there was a conference I was at and heard from a woman who waited 7 months from the date her doctor ordered her medication until she actually got it. And that is just unacceptable. We live in an age where you can go online and order something and have it at your door in an hour, and to force patients with life-threatening, life-altering diseases to wait days, weeks, months, we can't continue to do that. Every minute they wait for that medication to treat their disease is progressing.